Telemedicine is here. The question is it here to stay, or is this just part of the pandemic? And that's the world that we're living in. We're pleased to be joined now by Dr. Robin Motter-Mast. She's Medical Director of Primary Care and Population Health at GBMC. Good to have you on. Appreciate you coming on the show.
Yes, thanks. Thanks for having me this morning.
Telehealth is, popular these days, and I've used it a couple of times with my kids. I actually have an appointment with my doctor today that will be done via telehealth. I'm curious, how has it gone so far to this point?
It's gone amazingly well. So this was a project we had been working on prior to the COVID-19 pandemic, and we're ready to go when this happened. So we've done almost 18,000 video visits as of the end of this month.
What's the biggest problem that you have as a doctor with the telemedicine?
The biggest thing is just getting people up and running on it. So picking the correct platform. We're trying to use MyChart, which is a tool through Epic. Mm-hmm. But if that doesn't work, having backups, and then getting patients figuring out how do they check in online.
You can't do the normal things that you would do, right? When you go in there, and that is check for a temperature, do the blood pressure, weight, those things that are kind of staples of going to a doctor's visit. Are you pushing that on to the patients themselves? How is that working, and how really important are those types of things that we normally get when we actually see a doctor in person?
So those little pieces of information provide us with a lot of facts and help us to do our work as clinicians. They are very important, and that is something, figuring out how to get the information to the patient ahead of their visit to see if they can gather any of that information to help us make our visits more meaningful. So we've been, could you collect your weight, your blood pressure? Do you know what your height is? And that gives us, and temperature, of course, that gives us some great information to help manage patients not with just only acute issues, but also maybe with managing their blood pressure at a time when it's been scary for people to come into the doctor's office or go anywhere. So trying to help them continue to manage chronic disease at home in a safe way.
Yeah, I didn't think about it. Blood pressure is another one, right? Most people probably don't have a blood pressure gauge, although they're really not that expensive. What do you do in place of that?
We ask people, especially if they have blood pressure issues already, that they get a cuff. So they usually run between $30 to $50. You can get a really good one. But having that information at home for you, not just during this pandemic, but in general, if you have that type of chronic illness, is something that we recommend our patients to do. So
we're talking with Dr. Robin Motter-Mast, Medical Director, Primary Care, Population Health at GBMC. So what about wait times? Like, that's always been kind of an issue at doctors' offices. We know you guys are busy. Have the wait times been better via telemedicine?
Yes, and that's been one of the comments we've had from the surveys from our patients about decreasing the amount of time it takes them to see a doctor. So it's really nice. I can't say the doctors are still always on time, but at least if it's at your home, you're able to do something else while you're waiting for the physician online. So, and I would say that we are running closer to on time when we are doing video visits compared with in the office visits.
I know a big portion of this, of why we didn't have it as robust as we do today during the pandemic, was because the insurance companies didn't really want to cover these visits. What do we know about that? And do you basically think that this could be here to stay in some fashion of the telemedicine?
I absolutely think this is here to stay. I do anticipate there might be a little bit of a rollback from the insurance companies. That was one of the major limitations in really getting telehealth off the ground. People weren't willing to pay for it. There were a couple insurance companies out there that were pushing it and really wanted their network of physicians and providers to do this, but some did not. So now just about everyone has allowed almost the majority of type of visits that we complete in the office to be done in the office and paid through telehealth coding. This has been a really great thing. I don't think it'll go backwards. I think there's a convenience for the patient as well as for the office staff, especially during the pandemic. We've been able to keep our patients safe and our staff safe while still providing excellent care.
Do you fear misdiagnosis because you don't actually get to see them and you can't touch them and do all those vitals yourself?
Absolutely. I think that is something that we as a provider have to pay attention to as well as a patient. There are most certainly things that still require personal touch and visits to be done in person. What has been really wonderful is to be able to establish that ahead of time online. So if you are hearing things from a patient that you think really require you to lay your hands on them and really listen or touch something or feel something, then you're able to tell that patient to come in to the office. But we are finding that there are a lot fewer of those things than we started out with. Providers thought we had to touch everything, but I think we're all finding that we don't have to do quite as much in person as we had thought.
Very good. Fascinating stuff. Doctor, good to have you on. Thanks for your time.
Thank you. Have a great day.
You too. Dr. Robin Motter-Mast, Medical Director, Primary Care and Population Health at GBMC.